Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning. My name is Dr. Nariman, and I just would like to welcome you to the second Adam course. It gives me a great pleasure actually to welcome you on behalf of the course organizers of the second Aesthetic and Applied Method course, which is an acronym for the Adam course. To give you more details, more technical details on the program, I'd like to call upon Professor Rashid. Thank you.
Assalamu alaikum. Very warm morning. Based on what Dr. Naiman said, okay, I have to admit, I think she covered every single thing, but just would like to remind you the objective of this course is to, as specified, to enhance the knowledge, okay, didactic knowledge, but also clinical skills related to aesthetic dentistry. In most cases, when we deal with patients, we see only the clinical aspect, while there are other aspects, hidden aspect we call it, that only the patient is aware of, this emotional and psychological aspect that we have to address. And of course, our speakers will, throughout this course, will address all these issues and challenges that we all face when we deal with aesthetic dentistry, but also throughout these lectures you will be provided by innovative solutions.
This course could not have actually been organized without the generous and gracious support of many of our sponsors and supporters. And for that, we would like to take this opportunity to thank them. First of all, we would like to call upon Mr. Luigi Luneta on behalf of our platinum sponsor, Care Howie, gold sponsor, for their support. On behalf of CLICS, I would like to call upon Professor Mohammed Zairi. From Creative Arts, our silver sponsor, I would like to call upon Dr. Michel Bashour. Our bronze sponsor, GSK GlaxoSmithKline. On their behalf, I would like to call upon Mr. Loay Wakil. Ms. Mona Grid Burzek. Dr. Hadil, representing our esteemed partner from Asnan Portal.
Good morning, everybody. The title of my presentation is really deep because, when you drive in Dubai, you see all these clinics with the word smile. The good news for you guys is that, it's an industry which is growing. More and more people are spending money on their teeth, on their looks, veneers in particular, and there is technology. You're restoring difficulties, you are helping people, with their physical requirements, but also beyond that. So that is a growing industry. The value of a smile is really beyond what you in this room imagine and what people for themselves imagine. First of all, it costs nothing, right? The richness it gives to people is really beyond imagination. When somebody smiles, there is a trigger mechanism, there is empathy, there is a connection, there is reassurance.
Good morning, everyone. I'd like to welcome all of you here. It's good to see you all. Our topic today is new trends in aesthetic dentistry. It's quite a wide topic, and the purpose of this lecture is mainly to introduce the whole course to all of you. We're in an aesthetic dentistry course, and we are basically here to learn the new trends in aesthetic dentistry. So it is really important for us to go through a lot of points. We'll be talking about everything without getting into too much details, because most of these points mentioned here will be talked about in the second module. We'll talk about a little bit of history, bleaching, direct and indirect veneers, non-prep veneers, a little bit about porcelain and inlays and onlays, CAD/CAM, mock-ups, smile makeovers, lasers. So it's going to be quite a fulfilling lecture, but at the same time, not really deep into the topic. Now, someone once said, to predict the future, you must know the past. Correct. So we will have to go through a quick journey in the past, a little bit of history. Interesting. I chose this painting by Edgar Degas, which was painted in the 19th century. As you can see on the painting, you can see the ladies with the fans, and this was a noble gesture. in the 19th century that ladies would have the fans covering their mouth.
Assalamu alaikum warahmatullahi wabarakatuh, and a very good morning to all my fellow colleagues. Today we're going to talk about facial beauty over the next 50 minutes. Facial beauty is an interdisciplinary activity, and we have to recognize the importance of teamwork in this activity. There are many philosophy and concepts of facial beauty, and for today we want to look at the facial soft tissues, the dental and the skeletal aspects in relation to dentistry. However, what is beauty? There are two ways of looking at beauty. The first is the artist's impression, and the second is mathematical proportions. Similarly, when we look at the face, we can measure the face, right? What should the size of the ear be? What should the size of the palpebral fissure of the eye be? So we are looking at some mathematical numbers. Therefore, today we are going to talk about beauty from mathematical proportion.
Thank you.